I'm Dr. Flora Peivandi, Professor of Internal Medicine at University of Milan. I'm Director of Medicine, Center of Hemostasis and Trombosis, Angelo Bianchi Bonomi. My group is including more than 50 scientists, doctors, physicians, and also biologists and biotechnologists who are trying to work together to take care of our patients affected with any kind of hemostatic disorder, rare disorder like hemophilia. We are trying to make the diagnosis of these patients since when they are children, trying to make the best treatment and the most suitable at advanced treatment in this group of patients. Then we are just following them by time during the adolescence and adult age. They are also have facility to use the clinical trial and to get the best treatment available for each single patient. We take care also of patients who did have a thrombotic disorder in terms of best prolonged type of treatment and any eventual type of complication or prevention to prevent the re-event of thrombosis. We also have a large group who are taking care of the macroangiopathic thromboembolia, and this type of TMA, particularly thrombotic thrombocytopenic purpura patients, are having the facility to use the plasma exchange, and again the most advanced type of treatment which has been started last few years in Milan, which ended up with a publication in New England Journal of Medicine last year for novel therapies to increase the benefit for patients. How this type of research is improving the life of our patient. We take care of any complication that the novel drugs could create, like, for example, the development of inhibitors in children affected with hemophilia. In the first 20 or 30 days of exposure, days of treatment, some group of treatment are more immunogenic compared to the other ones, and this again ended up to a publication in New England last year. And now my group extensively is trying to focus on the reason and physiopathogenesis of mechanisms who are leading this type of higher immunogenicity compared to other kids treated with a different type of product. We think this kind of research could help to improve the quality of life of patients with the better treatment, the more accurate diagnosis, and improving the knowledge in the field of such an orphan disease or rare disorders where we know that there are very low resources. So as a reference center, one of the European reference centers in the field, we feel is really mandatory to work with scientists and physicians together in order to improve our outcome in this field.